Without any more ado, when I first started doing bioethics about 25 years ago, I was also teaching legal profession here at the law school. And I was astonished by this contrast. Many of you, I suspect, have taken legal profession. The contrast was that lawyers had these elaborate rules about conflicts of interest, and doctors never thought about it. On the other side, doctors had quite a lot of interesting thinking and discussion about informed consent and dealing with people under disabilities. Lawyers never thought about it. So, if you just looked at the professions of how, well, medicine has, and particularly scientific research, has caught up on the conflict of interest end of things. And today I'm delighted to welcome the director of the Conflict of Interest Office here at the University of Utah, Marc Rinehart. Marc got a bachelor's degree in zoology at LSU and a PhD in neurobiology at West Virginia. He worked for several years here in neurogenetics lab. Yes, I can't even read my own handwriting. You can tell I'm not a scientist. Studying movement disorders and how they affect brain physiology. And for the last 3 years, maybe 4?
So maybe 3 years in summer, yes.
Has been the director of the USE Conflict of Interest Office. So without more, Marc.
Thank you, Leslie, for the invitation and the introduction. And thank you for coming, and hopefully we can wrestle some of these issues that I have with financial conflicts of interest in academic research. Leslie mentioned that we're catching up. We might be, but it's still very messy. We're kind of kludging things together, and not just from a COI office perspective or an institutional perspective. I think the whole domain under which financial conflict of interest and science fall really doesn't get good guidance, and that's from feds all the way to local policymakers and down to individuals. We really are trying to find ourselves. Big reason for this is we overhauled things barely 6 years ago. So we're still trying to identify what needs attention, what's working, and attack the challenges that we know we're going to have to face in the future. And hopefully you'll get a sense of that throughout the talk. By the way, if you have questions during any time in the presentation, feel free to ask. I'd much rather have this to be more of a discussion than a lecture. So I have no outside income to that which I receive from the University of Utah. Financial disclosures are becoming common practice in scientific journals and in presentations. It is almost required by, I know of none, to be honest, that don't ask for a conflict of interest disclosure when you're submitting a scientific article to a journal. So in compliance, there you go. According to our policy at the university, a financial conflict of interest in research exists when an individual has a financial interest that's external to the university and has the potential to influence or bias the design, conduct, or reporting of his or her research. We see financial interest. It's also important not to get financial interest confused with conflict of interest. Financial interests are just making money on the side. Conflict is when it becomes a problem with your responsibilities here at the university as a researcher. We see two main types of financial interests that end up creating conflicts of interest, which we have to identify and manage as an office and as a committee. So the first type of financial interest that we see quite often is industry partnerships. So whether it's income, outside income in the form of consulting, speaking, honoraria, or if it's an equity ownership interest in the company. That's the first type, and probably the most common type that we see come through the COI office. But to give a little history about where these types of relationships and conflicts started, we'll take a quick look at the example of the tobacco industry. So in the early 50s, there was strong scientific evidence and a consensus among scientists that smoking causes lung cancer. In response to this evidence, the tobacco industry united, banded together, and took a novel approach to discredit the original findings. Two things that they did. The first was to create what might be the first known scientific advisory board on behalf of an industry. In doing so, they recruited credible but potentially overly skeptical scientists from academia to serve. It also just so happened that they were fond of smoking, so another bias within. The second thing that was novel about the tobacco industry's approach is their extramural funding for research. So they had funded projects in the past, but it was without any stipulations. Just give a researcher money, academic freedom, do what you will with it. This approach changed that. So the Scientific Advisory Board would take proposals, and they would only fund the ones that produced a tangential result to what the independent scientists found originally. For example, instead of trying to dispute the fact that the soon-to-be well-known fact that smoking causes lung cancer, they might fund a study that looked at genetic correlation with lung cancer. If that proved to be true, that there's some sort of genetic component to lung cancer, then they would use those results to dispute the original results of smoking causing lung cancer. So in effect, what they did was just stir up controversy and make for a debate that was actually not fruitful and productive. In doing so, these tactics led to a nearly 5-decade-long delay in the public receiving or generally accepting the original results that were found in the 50s. So an extremely effective campaign done knowingly and willingly to not find the truth, but to subvert those findings that could affect their profit. This might all sound familiar. Scientific advisory boards are now ubiquitous. Every company seems to have them. They also sponsor research that is highly formalized. The industry formulates a hypothesis. In some instances, they will get input from researchers, but overall, the design of the study is in place, and they provide the money and say, go do this project. This model has been followed by several other industries. We see it in pharmaceutical, agribusiness, energy, and food industries. Right now, probably the most well-known is the climate change debate and the energy sector, or energy industry, kind of using the same techniques that were used back in the late 20th century. So a more specific example of an industry-related COI comes from the Markinson case from the University of Minnesota. In 2004, Dan Markinson committed suicide after participating in an AstraZeneca-sponsored trial looking at the effects of Seroquel on schizophrenia. There were several there were several moments in the study that provoked some sort of concern, yet nothing was made of them. Mostly those came from Markinson's mother. She refused to allow him to consent to the trial from the beginning, but he was of age, so he decided to consent himself, kind of. What the backstory is that his physician, who was also the primary or principal investigator on the study, had referred him to an involuntary care unit. He allowed Dan's release from the unit if he followed the protocol, and were he to get off the protocol and stop his medications, he would be returned to the involuntary care unit. So, as you can see in the first finding of misconduct, the subject was coerced to enroll. The investigation after his death also found that he was incompetent to consent because of his disorder. Improperly enrolled, he was a suicide risk, and that is an exclusion criterion on the IRB application. There was evidence of data manipulation, a failure to disclose financial conflicts of interest to research participants, and there was also evidence of study coordinator misconduct. So we'll look at the individual conflict of interest. There are 3 parties involved. The chair of the department at the time was a co-investigator on the study, received $112,000 from AstraZeneca before, after, and during the trial. Stephen Olson, who was Markinson's physician and the principal investigator, received $149,000 between 2002 and 2008. And then Dr. David Adson, who was a colleague of Olson and Schultz, not on the study. He did receive $149,000 from AstraZeneca, but his role in the study was that he was the IRB chair of the panel that approved the study and allowed it to continue forward. He was also on the conflict review committee, and he approved the study there as well without requiring any sort of management plan for the conflicts of interest. So this, maybe not to this significance and this scale, but this represents the type of conflict of interest that we probably most often see at the university. Second most common type is related to intellectual property. Now, before 1980, I show of hands, how many people are familiar with the Bayh-Dole Act? All right, not enough. Prior to 1980, intellectual property that was developed by or through government funding belonged to the government. So ownership of the IP that was developed through the research, ownership went back to the government. Bayh-Dole of 1980 said the government can't commercialize our technologies and get it to market quick enough. We're going to give ownership rights to the institutions where the research is being conducted. So 1980, institutions now owned intellectual property developed at their facilities. This resulted in a boom of technology transfer offices, which made Bayh-Dole successful. Universities did a much better job of bringing technologies and discoveries to market. However, the consequence of that was that, of course, in doing so, we're giving research outcomes and products and discoveries and technologies a commercial value. So once that IP is commercialized, it has a value. If the investigator wants to continue research on that, there's a conflict of interest because whatever the research says has a direct financial impact on the technology. The other thing that came from the legislation was an increase in startup companies generated by universities. And oftentimes universities retained some ownership interest in these companies. So what you're seeing is not just a conflict for the individual inventor, but a conflict is developed for created for the institution as well. The most well-known example of this is the case of Jesse Gelsinger. In 1999, he turned 18. As soon as he did, he enrolled in a clinical trial for gene replacement therapy to treat a rare metabolic disorder. 4 days into the trial, after starting the drug, he died. It was later found that the University of Pennsylvania owned the patented technology and 5% in the licensing company. The PI, James Wilson, was the lead inventor of the technology, and he owned 30% equity in Genovo. This is the second most common type of conflict that we see at the office. Again, we usually don't deal with things that end like this. Maybe part of that is because we catch it and prevent it. I'd like to think that. However, this scenario is so egregious that I don't think this could happen at any university anywhere, where IP is developed at that institution and then directly tested without independent or external verification before coming back. Not as a result of the previous slides, but another piece of legislation that had an impact on conflict of interest offices was the Physician Payment Sunshine Act and the Patient Protection and Affordable Health Care Act of 2010. The Sunshine Act established an open payments database to be run by Centers for Medicare and Medicaid Services. And what this database does is catalog industry payments to physicians. So whether any physician whatsoever, if they receive any income from industry has to report that payment to CMS. The first data came out in 2013, and I think they have data through 2017. You can look up your own physician if you choose to, see if they have any financial interest in companies. Another piece of that legislation led to a change in the Public Health Services COI policy. Public Health Services includes the NIH, which is the largest federal funder of biomedical research. Two big changes here. The policy changed its threshold for what it considered significant, or that dollar amount that they thought could create a potential conflict and required review, and changed it from 10,000 to 5,000. No scientific evidence, no rationale behind it. It was just an arbitrary change in the hopes of making the policy look more strict. The second big thing they did was to place the responsibility of identifying conflicts of interest on the institutions. Prior to this change in policy, an investigator received an award from NIH and then self-disclosed or self-reported any conflict to the agency. Now, the onus is on COI office. So in a way, this was a job creator. We overhauled our COI policy in 2012 in response to this change. And what we did was we took it mostly and made it our own, so it mirrors the NIH policy. There are several institutions that just tacked it onto their existing policies so that they treat PHS-funded research differently than what they would from industry sponsors or other funding agencies. So this gets me to the hornet's nest of my problem, and not today, but in general. is what NIH did, what the university did, enough? Is it significant? Is it necessary? Are we over regulating? Are we under regulating? We don't know. And I think I don't think the NIH knows. I don't think anybody knows. The investigators will tell you that we're, of course, over-regulating, but we're identifying more conflicts of interest than we ever had. So their argument isn't a strong one. But to answer the question, is there evidence that industry money directly affects investigative behavior? We don't know. There's plenty of circumstantial evidence out there suggesting that just having industry sponsor your research can end up biasing you consciously or subconsciously so that you will, or there's the potential to manipulate the research. A lot of these studies are incomplete. A lot of meta-analysis on publications which are driven from poor or incomplete data sets. Most of the time, industry only publishes positive results, so that's going to skew things to make it look like investigators who are doing research for industry are pro-industry, and that might not be the case. What we do know from these examples is that the appearance is terrible. There's smoke, right? Whether you say that, okay, the conflicted investigators in the Markinson case didn't directly do anything wrong, so we can't say that their 140 grand over 10 years caused that poor man's death, or it led to misbehavior in a way that they didn't take notice of the potential for him to harm himself. We just can't dig that deep into the details at this point. But we do know that 3 investigators, or 3 members of the department were highly conflicted, and it didn't turn out well. In order to prove the science behind financial interest causing bias in a researcher's behavior, which manifests itself in research misconduct or behavior, is a very, very difficult cause and effect line of investigation to follow for several reasons. Research misconduct and research misbehavior by themselves are very difficult to identify. And even when you do, then to follow the line of causation for that behavior is nearly impossible. So what I'm saying is the thing that keeps me awake at night is going to keep me awake at night for a while. There is hope, though. This is an interesting study. The data was actually pulled from the Open Payments database 2 years after it was created. And it starts to hone in on the issue of how does money affect collective groups of people. In this case, industry payments and how they affect prescribing patterns. What we see is as the size of the amount of the gift goes up, so do the amounts of, or the number of times that that physician prescribed name brand drugs over the generic. Getting to get some evidence, but of course, something like this is always going to say, throw another wrench in your plans. So even here, in these results, we have variability. If we kind of piece together the idea of my perfect experiments, we have variability amongst the types of financial interests. You're going to have variability across the different types of people who are conducting the research. And then you're going to have variability in how that research is affected by the bias. So getting back to our responsibilities, and assuming for a moment that we're going to follow this blanket approach, and instead of identifying what a conflict of interest is and how it works under certain contexts, instead we'll come with a top-down approach and just try to eliminate bias from research. When we do that here at the U, when we identify and manage conflicts, what we're also doing is ensuring compliance with government funding agencies, providing protection to faculty in the institution, providing protection to participants in human subjects research, and we're promoting scientific integrity from our research community. In short, hopefully we're producing good science that can be used outside the university and in other realms. So how do we do it? Three main categories of management if we allow the research to be conducted here at the U. Transparency, disclosure and publication of presentations, as we alluded to earlier. Disclosure to the research team. The idea there is that collaborators are aware of the conflict and there's this internal kind of oversight by peers. Also, we want students and subordinates to be made aware of the conflicts so that we can provide protections from them from any potential misbehavior on the part of the conflicted individual. We're concerned with data integrity. If you can blind the data, that's great. Bias from the conflict shouldn't affect that in any way. If not, we'll have a non-conflicted peer come in and do the collection and analysis. And then our most staunch measure is a peer monitor who will document the process and submit an annual report to the COI office, in which the office and the COI committee will review. And then finally, patient protection, disclosure to the participants, allow them to be informed on the informed consent, and recusal from the consent process. We don't want a conflicted individual to be in the room when that patient is being consented for a clinical trial. What we'll do is have another non-conflicted member come in, explain the conflict of interest to the individual, and then garner. And then to keep up, we conduct annual compliance reports. So every managed individual on every managed or every study on which they're managed submits an annual compliance report. COI office goes through it and verifies whether or not they're compliant. We have a slightly stricter enforcement of COI management in human subjects research, which we call the rebuttable presumption. And that is the presumption is that a conflicted individual should not be able to conduct research at all. The COI committee provides the opportunity for that individual to rebut the presumption, and if a compelling circumstance can be made, the committee will consider allowing that individual to conduct research if and only if a suitable management plan can also be applied to prevent bias in the research. So again, with all these issues, the conflicts, the poor appearance, the willing subversion of science by the tobacco industry. Why does the university allow our investigators to interact and to establish financial relationships with companies? History. The big one is there's limited federal funding. If you look at federal funding from 2004 or so on, it's essentially flat, except with one little peak that was the stimulus that was issued during the recession. There's a reduction in state support of public universities. Many states are practicing austerity, and public universities are feeling it and losing revenue. We do want our patients here at the University Hospital to have access to promising new treatments and drugs and devices. So for that reason, we want to welcome that sort of partnership. We want the good science to come through if it means positive outcomes for our patients. Again, going back to Bi-Dole, it was successful, and it has essentially provided a new incentive for revenue through startups and commercialization of IP. And then overall, which I think the first four kind of give you an idea of, is that in the last couple of decades, institutions have adopted a more business-centric approach to research. More grants mean more overhead dollars, more spent on other things. But at what cost? If we think about the conflicted investigator who's conducting research, just going about his business, but then Pfizer calls and says, I want you to consult for me. That triangle then creates a conflict of interest, correct? There's no difference in a university who's supposed to be conducting quality research, then goes out and says, we're going to find more ways to find money to support our initiative, especially when it's related to the research that they're conducting. So it's that analogy, or that analogous relationship, then makes you wonder, are there things that the universities are doing that have consequences on their researchers? If universities are feeling the crunch and the squeeze for money, what does that look like, and how does that manifest to their faculty members? The first headline is a screen grab from The Atlantic in 2016, getting at this exact point. Questioning whether or not universities are operating more like businesses and less like a social good. The bottom quote is from Peter Higgs in an interview with The Guardian. Peter Higgs, how many people know? Lawyers. Peter Higgs won the Nobel Prize in 2013. He predicted the existence of the Higgs boson particle, which people at the time, or just recently, were calling the God particle. Several decades after he predicted it, it was experimentally verified at the CERN particle collider. And after proving Dr. Higgs correct, he went on to win the Nobel Prize. In this conversation or interview with The Guardian, he declared that he wouldn't be productive enough in today's academic system to have the same success that he did. Now, this is just one person, but I think of that stature, maybe we should at least hear him out. And if we do hear him out, what would this mean for financial conflicts of interest as a definition, and relative to how we're dealing with them now and how we define them in our policy? The first two types of financial interest are what we have explicitly stated in the policy. These are not, and that's because these are considered internal to the university with university oversight, meaning that there's no financial influence. However, I would argue that there is. So, securing funding is often a requirement of tenure. It's also strongly recommended, at least in some departments, that research funding go to supplement salary. I would consider this then a financial interest. Indirectly, we have this idea that I think Peter Higgs was getting at, is that the productivity requirements from institutions has increased so much so that he couldn't keep up. And I think we've all heard, at least I'm sure the faculty members in the room have all heard of Publish or Perish. That is putting out enough papers that you meet annual metrics for your department, for the university, whatever it might be. It also sets you up to get that grant later down the line. Problem with Publish or Perish is that it promotes quantity over quality. So we're getting more and more publications, but are they standing up to the quality of science that was done before institutions kind of took this business initiative? Maybe. There might be evidence for this, but like everything I'm presenting today, more information is required. So does productivity and funding requirements affect research? There was a survey conducted by Nature in 2016 where they surveyed 1,500 scientists across several disciplines, and the response was that more than 70% of researchers have tried and failed to reproduce another scientist's experiments. Interestingly, somewhere between 40 and 50% also failed to replicate their own experiments, one or more of their own. And they cited two top factors. The first was selective reporting, cherry picking of data so that whatever was left over, when analyzed statistically, met or supported the hypothesis. This number two factor cited was this pressure to publish. So, kind of getting back to putting the pieces together of it looks bad, we're pretty sure bias is created. Every once in a while we see poor results and poor outcomes when we have a biased researcher. How do we put it together and understand how to effectively and efficiently remove bias from research that's created by financial conflicts of interest? And again, to start, we need to better understand how and if financial interests affect individuals. This is a much more difficult task than just this, because we have a number of different types of financial interests. Value of those financial interests come into play. We have a number of different types, an array of types of investigators. You could be poor, you could be wealthy, you could have a different moral compass than somebody else. All these issues come into play. And then, inevitably, how do we measure if there is bias to the research? How do we measure the output of that bias in the behavior of the research conduct? I think that approach is going to take time, a lot of time. So in the meantime, if funding agencies and regulatory bodies see this assumption as a legitimate existential risk and we follow suit, then I think there are a few things that we can do to minimize bias in research from money in the meantime. The first, paradoxically, maybe, is more federal funding. And if money's the problem, why add more money? Well, if it's coming from the federal government, hopefully it's enough so that it eases off the pressure of institutions and investigators, so they feel a little bit more sense of freedom. Change the incentives, institutionally and individually. One way to do that might be to devise metrics to promote quality research over quantity. Greater scrutiny by the scientific community. Peer review was also mentioned in that Nature article as a concern for lack of reproducibility, because peer review, as a general consensus across fields, the consensus is that peer review has been failing us in a slow, kind of degraded manner. Part of the thorough peer review might depend upon the investigator to provide full data sets, all the raw data, complete documentation of what was done during the experiment, so that peer reviewers can better assess what happened and evaluate the outcomes. More administrative oversight. I'd be hesitant to do this because half of campus says we have too much oversight. The other half of campus says we don't have enough. That probably means we're just about right now. But I think there are things we can do, especially with regards to compliance, to better ensure our faculty are producing ethical science. We take a bottom-up approach, educate researchers, have them understand that a financial interest can affect them in ways they might not be aware of. If they become more enlightened about the effects of money on the research, and then maybe they can take steps and approaches to prevent bias from entering into the scientific process. Educate the public, and the pipe dream. But one that several people have had in the past. Can they be better consumers of science? Can we educate the public so that when they see science coming out of tobacco industry and say, well, I'm going to question this, I'm going to be a little more critical about this. I think that would go a long way in preventing at least the unnecessary debate from lasting 50 years. The last two are very interesting and recent. The first is pre-registration. The idea behind pre-registration is that a researcher will submit a proposal, a scripted proposal to an agency. Center for Open Science is leading the way on this. So the proposal is sent, a group of people review the process. They'll say this is a good testable hypothesis, methodology is good. Yes, your data collection techniques will be fine, but you might need to change your statistical analysis. Use this method instead of the other. They all come to agreement. Investigator goes back to the lab, does the research, brings the result back, and compares them to what was originally proposed. This should, in theory, promote more valid and verifiable outcomes for research. When I first heard about this at the AMC conference, the very first 6 complaints were, somebody's going to scoop me. So if you have to make public your ideas for research, it's that competitive even out there that there's a chance that you could lose it to somebody else. And lastly, artificial intelligence. An article just came out Monday describing a proposed project between the Department of Defense and coincidentally the Center for Open Science, who are behind the pre-registration thing. What they're looking to do is to see if they can find an artificial intelligence mechanism to identify results, whether they're published or just findings, that are likely not reproducible. So what they want to do is cut through the bad science and be able to filter it out using artificial intelligence. I think this is very interesting, and I could definitely imagine areas where we could use it in conflict of interest, especially focusing on bias in the individual and seeing patterns and evaluate and essentially observe the observer. See how different forms of monetary influence affect our researchers. So just wrapping up, a couple of links to those, the pre-registration artificial intelligence, the Open Payments Database, and COI office. That's all I have.
I've got some questions, but I know you guys do. Please.
I was just wondering, how different is pre-registration from like what IRBs already do?
Not nearly as comprehensive.
Okay.
I was going to say that they don't evaluate hypotheses and methodologies, but they do to some extent. Also, I don't think they follow up. Two, they're not a data collection agency, so they won't see any of the data. So their focus is very much patient protection, science kind of, if it affects the patient, they'll take a look at it.
I was just wondering if you could give examples or just go a little bit more in depth on what you mean by changing the incentives, like institutionally and individually. Examples of what that could be.
So changing the incentives, one, not rely so heavily on the number of publications, but look at the quality of publications. Not an easy fix there. Not pushing on the investigators so hard that they have this pressure outside of the normal pressure to accomplish their objectives. So I think as a result of the publish or perish thing, the need to be so productive is what I predict is causing the mistakes in the papers that aren't reproducible. I think there are other incentives, but it's hard. What I learned in behavior is when an environment is applying more pressure to an organism, the behavior becomes stereotyped. So if we relax that pressure, then our researchers will have regain a sense of academic freedom. They won't have to follow funding that points them in one line or one direction for one line of investigation, and they can follow the facts of their research and branch out. I don't think that's happening right now. So that's another sort of incentive.
I don't know if you touched on this, but if I missed it, I apologize. But is this self-regulated within the university, or are there any policies or laws, like state laws or federal laws, that you're under and that you're?
Yes, but not specifically for research. The committee deals with the Utah Public Employees and Officials Act, which says if you have any conflicts of interest, public employee cannot benefit financially from any transaction that goes through the state entity. So where we normally see those, they're probably just tangentially related to research, subcontracts in research. So you might get an award, and then you say, well, I have a company that makes, transistors, and we need transistors for this experiment, so we're going to buy transistors for my company. That's probably the closest we come to interacting with state law.
You kind of touched on both reproducibility and changing incentive structures. Is there a line on increasing incentive to do reproducing research that's not as highly incentivized as other kinds of research?
I don't know. So probably 5 years ago, psychology went through the reproducibility crisis, and now basic sciences are since 2016. I don't know what the psychology community devised to ensure that they're getting better, more reproducible results. I do know one of those things is that, again, coming back to the publish or perish, allow time for diligent research to be conducted. If the artificial intelligence thing works, then we can just, you get done running through the system and okay, next. But no, I don't know of anything. So.
Well, I just wanted to throw into to Carl's question. Marc's right. There aren't really laws out there, but there are two other sort of domains of conflicts of interest that people have to worry about. And one is The granting agent, the funding agencies, NIH has conflicts rules that, people have to comply with when they serve on committees and, other capacities of those agencies. The other one is, and the big one that's been in the news quite a bit, is journal requirements. And there's quite an elaborate and sophisticated set of conflicts, disclosure requirements that different journals have, that different medical and other scientific associations have, that journals abide by. Sometimes they have the same criteria as the institutional policies, not always. So, there's there are three domains really that people have to worry about.
Thanks.
So I've got several that have come in. One is just a question about the shape of conflict of interests here at the university. Is there frequent discipline for conflicts of interest? What would happen to an investigator who is found to have had a conflict of interest?
So if you're found to have had a conflict of interest, we will create a management plan that we think is appropriate to prevent potential bias from being exposed to the research. Now, what happens if they don't comply with that? Is that kind of the road you were going?
Yeah. So, I'll just give you so I was on the full disclosure, I've been on the conflict of interest committee.
So is George.
Yeah, there's been a case or two at least some universities.
Yeah, so.
Where, and you showed us a couple, but, examples where you read the ProPublica database and somebody's gotten $100,000 from a drug company and hasn't reported it in their COI statement. And
Yes.
it's the company that is sponsoring their research.
So if we come across that, we immediately consider that to be non-compliance with the COI policy, and we'll launch an investigation. Usually takes 120 days maximum, I think is what we cap it at. But we will assign that. If we find it, I'll take a quick look at it. If the complaint is legitimate, then I'll assign it to a couple of committee members who will go out and investigate, interview people, consider all the facts, and then recommend some sort of actions, and those could be sanctions, reprimands, putting a stop on research funding until issues are clarified. It becomes a horrible headache if human subjects are involved, because then we have to go back and work with the IRB and see how many people were consented improperly without knowledge of the financial interest. If there were, then was data collected. Now we have to do a bias review on the data that was collected. So in a situation like that, it can turn into a huge headache, and then by that time we have general counsel, maybe the CTO, clinical trials office, Brian Watt's office, the compliance office, or numerous offices are involved at that point.
So, another question that I have, or was there a hand? Yeah, sorry. Yeah.
So I can appreciate that your main concern is about conflicts of interest with for-profit enterprises.
Mm-hmm.
Can you say a little something about whether your office is dealing with or has on its mind the conflicts that might arise when a generous donor has provided funds to researchers, and how that might be shaping the conduct of PIs?
Yes, so it all depends on how the gift is donated. So if it goes through the development office, and then is this just a philanthropist?
Sure, yes,
If
just
it's-
an individual who
if it's-
is given a gift.
If Bill Gates gives a gift,
Brothers.
Or the Koch brothers, or.
that's a tougher scenario. Bill Gates is easier because he has, well, I guess you could use the Koch's energy companies. Yes, if the Kochs were to give money to the university, and then somebody in geology does a study that is either funded by or is related to Koch brother interests, we'll take a look at it. We'll consider that an institutional conflict of interest because the gift is coming to the institution. And then what we would do is, let me backtrack. We'll only do that, our institutional conflict of interest policy only applies to human subject research. So if it's a geology department, we might not do anything. But if it was human subject research, then we'd take a closer look at how the university might exert undue pressure on faculty members to get positive results. Managing institutional conflicts of interest is much more difficult than individual because we're all on the one U. So everybody is essentially conflicted in theory. We have worked around it. Effective management strategies are to hire external people to serve on data and safety monitoring boards, distribute out the work to other universities so that the work that's done at the university might not necessarily have a statistically significant impact on the findings of the other universities or sites. So things like that.
So another question that I got is sort of a broader, how do you decide what's a conflict of interest? Most of these are all about finance. There's one that's a little bit more limited, or not so much finance, like do I get tenure?
Yes.
But what about just things like, aren't we sort of all conflicted in the sense that we want things to come out the way we want them to come out?
Absolutely. Yes. Every research project is conflicted. Every decision we make of interest is conflicted, right? It's part of human character. And I don't think, we often grapple with this kind of a more philosophical approach to it. And we especially had this fight over intellectual property. When is that considered a financial interest? It really is when you conceive it in your mind, right? I see this wonderful product that I can invent. I'm going to dedicate my time and resources. I'm going to create that thing. The bias and the incentive and the motivation are all kind of the same as getting a piece of pizza from Novartis and conducting research for them. It's there. But the NIH and the University of Utah really can't define that in a quantitative way to say that's a conflict of interest. It would be, we would manage every project out there, right? So we had to come to some fine line in the sand. And NIH said, once your intellectual property receives royalties, or you receive royalties from your intellectual property, the University of Utah takes kind of a further upstream approach once the technology has the potential to be licensed. So if it's at the TVC and they're negotiating hard to get it licensed, we'll consider the financial interest to be reviewed at that point. But yes, but that's why in the ideal world, scientists act like automatons and exert no personal bias on research, which of course is false because every investigator is biased.
So can I say a question following up on that, and then going back to my earlier question about benefactors, and not that companies and other financial interests can't impact this decision making in the same way, but in thinking about the list of things that you would look at as dependent variables to see what gets impacted, I mean, just your choice of research question, right? Like the things that we think are worth investigating at a university, is that something that you think can be regulated by a conflict of interest policy or office, or does that get so far into academic freedom issues that like you just have to give that one away and then try to police it on the other?
Yeah, and that's, I think, prefacing conflict of interest with financial kind of addresses that to some extent. But you're really talking about just the not the scientific method, but the overall process of science, right? There's a creative stage where you're contemplating findings and observations, and you're putting things into place. And yes, I think a lot of times during that time, scientists are at a minimum emotionally invested, right? I don't know how financially invested they might be, but yeah, the idea provides the incentive, I think, in that moment of contemplation and great idea. But I would counter that a well-trained scientist, once they have the idea, they can put it into the form of a hypothesis. At that point, you need to be dispassionate and let the system and the process play out.
Yeah, well, let me just play out the thread in Tammy's question a little bit, right? So going back to the Koch brothers, and students who haven't been here for that many years probably don't know or may not have heard that probably, 3 years ago, there was quite a flap internally in the faculty about the Koch brothers donating, $10 million to the business school. Many, the Department of Economics wanted that never to happen. Business school wanted it to happen. And, so those of us who were there remember this, but, 5 years from now, not as many people will. And so I think Tammy is right. I mean, the questions that economists will ask and the types of issues they'll want to study may change, right? You may not, you may be discouraged from studying like the impact of guns on, different communities, and instead you might want to look at, the advantages of free markets in commodities and things like that. So to what degree, even informally, do we ask or expect that all the faculty in our business schools somehow disclose this funding, right? They haven't renamed the business school, as far as I know, so that flag isn't there. But, is there some clear way? And so we know, so like George Mason, right? This is the poster child for Koch brothers funding. Mm-hmm. And you see any article coming out of a George Mason faculty department, you read it with a grain of salt, because who is behind George Mason.
Right.
But our funding isn't nearly as much as theirs yet. Is there any way that we ask our faculty to signal, sort of those types of loyalties? No, and we wouldn't even be made aware of that by our current mechanisms, because it would be no different than the Eccles Foundation, right? It's just a philanthropic group that donated, and now I think there are issues to be worked out with the actual transaction, right? So supposedly these donations are supposed to be made with no strings attached, right? It's just a donation. I understand, yes. Otherwise, George Mason, Florida State, wouldn't have turned out like they had. But I think that falls on the shoulders of department chairs and college deans. Yeah, see, I mean, to me it seems, now that we're talking about it, it seems like those types of institutional conflicts are even, potentially more pernicious than ones involving human subjects research. Like the Eccles Foundation and the Huntsmans, whatever they fund, I mean, everybody agrees that we should try to cure cancer, right? And this is like a common good. That, even if you don't agree with the Huntsman's politics, that's not affecting, which, sort of cancer treatment is getting researched up at Huntsman.
Right.
But I think with Coke, it's like precisely, the types of questions. There's not a general agreement on what sort of business school research there ought to be.
And just to even make that tougher, a typical structure of a Koch brothers grant to a university is they'll give a certain amount of dollars up front. You hire the faculty independently, and then they don't give all of the money. There's a promise to give the rest. So if they're dissatisfied, there's the potential that you're stuck holding the bag. So that if the faculty at a place like George Mason didn't produce pro-free market stuff, then
Right, it's a carrot, very much an incentive
we got a
story.
stick in the background.
But that's the responsibility of our general counsel to make sure those kind of deals don't happen.
But-
I know they still do happen, and I can think of a recent example here that
Oh, well, yeah.
I won't address, but that also, made a lot of waves, and I don't think that's going to be happening again very soon, at least I hope. But yeah, as far as what we do, we don't even see it until it hits the account, and then we go, oh, okay.
So is there overlap between you and the Office of General Counsel?
Some, yeah, we work with general counsel to ensure that something fun we do. Especially in investigations, we work very closely with them. Sometimes I find myself working with internal audit on sensitive matters that general counsel will also be involved in. One of our ex officio committee members is a general counsel rep, and I think the majority of the input they provide really are towards kind of process, procedural things that we might get off course, and potential infractions of the Ethics Act when that arises.
And one other question that was, I'll sort of switch it a little bit, but the question, the way the question came in was basically, would we be better off not trying to do more science than we are with with the level of conflicted science that we have? I mean, wouldn't it be better to just sort of drop all this funding for science rather than taking the risk? That the way I thought it might, another version of that is, was Bayh-Dole a good idea?
Accomplish what it wanted.
Well, there are about 100 law review articles that tackle that
But just for
question.
yeah, I know, but just for the class to kind of think about, for a couple of minutes, is it a good idea to have all this commercialization money come out of the What?
You taught us this.
Yes, I teach this in college. Yes, is it a good idea? By-Dole.
That's my question now.
Yes, that's your question.
It made my job harder.
The witness is not responsive.
I might not.
Depends is the right answer.
It does depend. I think using taxpayer dollars to fund research deserves that technologies turn around and get back in the marketplace as soon as possible. There might be other entities that could do it better than the university. And if that's the case, then I would say move in that direction. Working with TBC, seeing how the sausage is made, I think there are a lot of problems that arise with tech transfer's office to kind of put blinders on and get IP out the door, generate startups, and they don't think of consequences for existing research on campus. But I don't think that's unmanageable. As far as the business, contributing to the business-centric approach of universities could be problematic in that respect too.
Just imagine the University of Utah without research work.
So, kind of on the other side of that comment about Bayh-Dole, I guess something I've been thinking about, without sounding super pro conflict of interest, doesn't regulation, I mean, isn't there a chance that it depresses good science, even if those investigators may be interested? So, for example, I think that money is definitely, especially a financial interest, because I know that money is important, of course, to everybody, but especially for researchers and investigators in universities, like notoriety and just standing out in their field, that stands for something as well, right? And earlier we discussed, or you mentioned a drug, I forget the name, it was sponsored by AstraZeneca, and it was
Seroquel.
Yeah, and if that happened, or if there are, how many other drugs are out there that might have a net benefit, but that were also the product of interested research? Does that make sense? These are just sort of large questions, but
All of them.
yeah, right. So that's what I'm getting at.
Yeah, all of them.
Yeah, that's what I'm getting at. And so, does this depress good science?
Absolutely, yes. I think there could be too much oversight, which, coming from a scientific background, I would like to know what causes what and when and why, so that we can craft policy to tackle that and to target that, so that we're not just covering with a blanket and stymieing potentially good research. And I think when we do this top-down approach from NIH, then we really are stifling potentially good research. Yeah.
Just to put that in context too, the Jesse Gelsinger case is generally viewed to have set back gene therapy for, that was 1999. And that really panicked people. You could take that two ways though, because it was premature to do it maybe. So if the conflict had been picked up, maybe it, if it had been better regulated, maybe it wouldn't have set back science.
Yes, and that's why I think there's a fine line, right? And give away my secret, I don't. We review a lot of research, but we manage 1% to 2% of it. So, to get to your point, right? Is it worth it? If we're only managing 1% of studies, and yet we're providing the same scrutiny to another 18,000 in the same year. I think we should be more efficient, and I'd like to figure out how to be. Because it's the bad actors that are the cause of these policies, sweeping policies, that then everybody suffers and has to deal with the bureaucracy. So yeah, if we could figure out ways, maybe artificial intelligence, that we could minority report where we can focus on those individuals who are going to be susceptible to bad research, to do it for the money and things like that, then that would be ideal.
So it seems like right now, all the responsibility for the oversight is on you. And like you said, you'd like to figure out ways to be more efficient in how you engage in that when it needs to be done. But picking up on Professor Francis's observation that there can be instances that set back gene therapy, is there an argument for actually just more allowance of these relationships and then try to put some responsibility on the companies, like tell the drug company you are responsible? Because right now you'd hope there's some self-policing where they don't want there to be an incident that then puts back their drug development and hurts their profits. But what if you actually, instead of trying to keep this conflict at arm's length, embrace it and like make the drug company a partner in the enterprise? Does that
That's actually where things are heading. Duke, Georgia, they're all in with industry partnership. So much so they're putting names on buildings and doing things like that. So potentially, yes, but none of the patients belong to, are not under the care of the industry, right?
They're their customers, even indirect customers through prescription though, right? So I guess you would hope they would have some sort of stake in their well-being. Because if things go bad, they go really bad.
I'll give you a cynical answer. Once they get approved by the FDA, then they go bad. Kind of made their money.
So that kind of raises one question. So this is more practical than any of the other philosophical questions, but does the FDA do any kind of conflict of interest sort of checks when it does these clinical trials? Because it seems to me a lot of the things that run through your office are clinical trials.
I wish they
They
did.
look very similar to the Gelsinger
Yes.
and other types of cases.
No, if those were registered clinical trials and they went through the FDA,
Right.
they have different standards. Of course, everybody has different standards. FDA won't even consider a conflict of interest until it's $25,000 interest. So we never run into
And
problems.
one PI.
In one PI, yes. The FDA has a standard set of protocols to meet each phase of testing. So as long as the companies work within those bounds.
Do they ask questions about IP and ownership?
That's a good question. I'm not sure. I don't think they care.
I don't think they care either. That's why I was asking.
No.
They should care. I mean, if they want there to be integrity in their trials, they should care as much as the NIH does, I guess is what I'm saying.
I think the FDA changes depending on who the director is and
Differently than the NIH.
yes.
It
Because
makes me very panicky about my drugs that I might take.
you should be. I mean, there's rules.
Like I need another reason to be panicky about the 2019 panic, more panic.
The process is kind of formalized and standardized at the FDA, so it's going to happen. I don't think there's a.
And they're thinking about safety, but I wonder if there are not safety concerns embedded in some of our conflict of interest concerns. So we might go down a path, we might create a clinical trial, sort of getting us to our most marketable drug that's not really our most efficacious drug, or might be our most expensive drug. It might be very different from what a different formulation might look like. I'm just kind of thinking outside the box.
Yeah, they don't care.
They only care about safety.
Well, there's the opposite kind of conflict too, which is where you're a participant in the study testing drug A, and you have an ownership interest in a competitor of drug A.
So your interest is in it failing. Yeah.
In the interest in the trial failing, and those show up at the CY.
Investigators love those.
Yeah. that exciting note, we thank Marc very much. Bring on the food and the tea.